Many people feel confused about female reproductive anatomy. Today, we'll clarify these concepts and processes. By the end, you'll understand the female reproductive system clearly. Let's break this down into simple, easy steps. First, we'll discuss external genitalia, known as the vulva. The vulva includes the labia majora and labia minora. These structures protect the vaginal and urethral openings. Next, you'll learn about the clitoris, a sensitive organ. Remember, it is homologous to the male penis. Now, let's move inside to the internal reproductive organs. The uterus has 3 parts, the fundus, body, and cervix. Understanding the distinct layers of the uterus is important. These layers include the perimetrium, myometrium, and endometrium. Each layer plays a crucial role in the menstrual cycle. Next up, the uterine tubes are where fertilization happens. They have finger-like projections called fimbria. These fimbriae help capture the oocyte from the ovary. Moving on to the ovaries, these are female gonads. They produce oocytes and hormones like estrogen and progesterone. Their support comes from surrounding ligaments and muscles. Now let's discuss blood supply to these organs. The internal iliac artery branches into uterine and vaginal arteries. The ovarian artery supplies the ovaries and uterine tubes directly. Let's shift focus to the pelvic diaphragm. It consists of muscles that support pelvic organs. Knowing about normal flora is also vital. Lactobacillus maintains a healthy vaginal environment, preventing infections. Next, we'll cover cervical anatomy. The endocervix has columnar epithelium, while the ectocervix doesn't. The transformation zone is significant for cervical health. It's where cervical dysplasia and cancer can develop. Following this, let's talk about the breast anatomy. Mammary glands, present in both sexes, function in females. The nipple and areola have protective functions. Lobes in the breast produce milk during lactation. Understanding lymphatic drainage is important too. Next, puberty marks sexual maturity around age 13. This process activates the hypothalamo-pituitary-gonadal axis. During this phase, hormone levels increase significantly. Now let's detail the menstrual cycle. Day 1 to 5 involves menstruation with low hormones. From day 5 to 14, follicles grow and estrogen rises. Ovulation occurs on day 14, triggered by an LH surge. Finally, day 28 marks the cycle start again if no fertilization happens. Oogenesis is also crucial. Women are born with primary oocytes, which are dormant until puberty. Each cycle, one oocyte completes meiosis to become functional. Understanding these stages is essential. Now, let's touch on menopause. Menopause is defined as 12 months without menstruation. It occurs due to decreased follicular response to FSH. Symptoms may include hot flashes, mood changes, and insomnia. Diagnosis involves checking hormone levels and history. For management, lifestyle changes and hormone replacement therapy might help. Consider contraindications before using HRT for safety. In summary, we covered anatomy, physiology, and menopause. Understanding this foundation helps in women's healthcare. If you enjoyed the video, please give it a like and subscribe to our channel. Hit the bell icon so you don't miss our next videos. Thank you for paying attention and joining today.